So we are here with Avner and Hila from Sheba Impact. Tell us a little bit more about Sheba Impact, Avner.
Sure. Sheba Impact is the technology transfer company for Sheba, really in charge of all organic innovation. So from even before the idea is created, in training the clinicians to be more innovative and entrepreneurial, through processing the ideas, patenting them, and all the way through maximizing literally the clinical and economic impact by commercializing this to the outside world.
And Hila has her hands and fingers on all of the interesting new emerging technologies at Sheba. Can you tell us a little bit more about some of the technologies that we may be seeing emerging from Sheba Impact?
Our portfolio today has about nearly 200 technologies in all fields of healthcare, mainly medical device and pharma, and of course, as seen in other places worldwide, we see a boom of technologies in the digital health space. So we have more than ever AI algorithms and platforms and just digital tools, decision supporting tools for clinicians developed here at Sheba. We have more data scientists and engineers sitting and working closely with the clinicians within the departments, interacting with the patients sometimes and their families to make it all work, yeah.
So one of the, you would say, the engines of change that emerges from entrepreneurship is something called Spark within your realm. Tell us a little bit more about Spark entrepreneurship.
Sure. So we've learned that we really have to give our clinicians better tools in order to be innovators, in order for the ideas that they push forward to actually have a chance to become real life implementations. But what more is happening is, since we are based in Israel, our clinicians have to think beyond their local environment, because no investor will ever invest in a technology that's focused just on the Israeli market. So they have to think global from the first day. In order to do that, we have taken our clinician innovation program and made that global. We call it Spark, and we take about 15 Sheba clinicians together with 15 global clinicians from 10 countries, developed and developing: the US, Germany, Switzerland, Japan, Australia, Nigeria, South Africa.
Neighbors in the Palestinian
and even
Authority.
Our neighbors in the Palestinian Authority, exactly. All of them sitting together, shoulder to shoulder, from ideation all the way to being able to pitch their ideas, all that in 3 months, combined physical meetings in Israel and the States, at the beginning and end, and a virtual 10-week intensive course. And we just saw them pitch to us here at the beginning of this week. It was amazing how effective they were in taking early stage ideas and making them into viable business propositions. From that point on, we can now take it forward and commercialize. But we really believe that in the process, they get the tools to become real players in the innovation world in global innovation healthcare.
You went on the road to Chicago.
Yes.
And did another event here in Israel. What do you think what are the kinds of technologies do you think might emerge from this type of unique group?
Yeah. So we can share some of the very exciting technologies that were presented there. On one hand, it's a technology to help open the blood-brain barrier to deliver life-saving drugs to the brain that today cannot be delivered, or an invention by a nurse. We actually like inventions coming not just from doctors, but also from nurses and other clinical positions, on an automatic way to do blood tests in the home. Imagine what it will be like to be able to do blood tests in the home automatically without a nurse. Or an invention from our Nigerian colleague, focused on how to develop hearing aids that are at a price point that's accessible in Nigeria and in Africa. So it's not just about first world development, but overall development of technologies for the whole world to really also close health equity gaps.
Hila, how exciting is it for you to be a part of something like this? I'm not sure you could even imagine this when you were in university.
Right. So I was in university and I actually came after about 6 years in a private practice. And the community and the innovation community in Sheba is really astonishing. For example, if you take the Spark program, when you think about it, for many of the clinicians participating in the program, it's the first time that they really need to deeply think about product development and market cap and business model. And they really learn, and here it was specifically impressive because within 3 months they learn how to speak this language of entrepreneurs. And for them, it's a toolkit that they can carry with them for the rest of their careers and other
Thank you.
projects.
Yeah.
That I think the important point is that these clinicians don't necessarily have to be actually the ones leading the companies created, but they have to, exactly as Hila said, talk the talk, be able to interact with entrepreneurs and know which ideas they want to push forward and how to work and be part of a team that really brings innovation to the real world.
Thanks to the two of you for being the spark of the spark at the ARC Summit.
Thank you very much.
Thank you, Steve.